Good morning and good afternoon and good evening, depending on where you are in the world. I'm Jonathan Edelheit, CEO of the Medical Tourism Association, and we'll be presenting today on our Buyers of Healthcare webcast, really explaining the benefits of participating as a buyer of healthcare and kind of what you're going to get out of the program. What are the benefits of participating in the program, and how to really maximize your experience at the conference and the exposition hall. And my co-host today is David Bryan, President of the Global Benefits Association, and I'm excited to have him participate today. I know he's very busy, always traveling, and on a lot of international conference calls. And he's going to present a little bit about the perspective of some of the buyers of healthcare coming from the global benefits side, because within our conference, we have the Medical Tourism Conference where we bring in a lot of buyers. Then we have the Global Benefits Association, which is a trade association of multinational employers and insurers that has their own buyer program. And then there is the Employer Healthcare Congress, which brings in about 1,000 of the top leaders from the U.S. health insurance companies and employers. And there should be more than 1,000 this year, as participation is really strong for our event. So really quick, if you're a buyer of healthcare, to explain the conference and some of the highlights is, we have about 2,000 attendees from over 100 different countries. We bring in over 100 speakers. We really vet our speakers all year long, focused on people who are national and international leaders, doing case studies, talking about best practices. And then this year, we really added a business development track, which is really some really amazing speakers just talking about, how to take your business to the next level. So we brought in, some New York Times best-selling authors and people who are always on the speaker circuit. I'm really excited for a couple of our speakers. We have Selling to the C-Suite, the New York Times best-selling author of that book is coming to speak. We have Marketing Healthcare Services. We have Kevin Faux, who is the top healthcare social media guru in the country. He has the most followers out of any doctor or healthcare organization in the world. So we're bringing in a lot of people to tell you, how do you take your business to the next level? How do you increase the number of patients you're getting? How do you market better? How do you get into the C-suite? And how do you convince healthcare consumers to actually utilize your services over someone else's? So we're really building out the business development track. We have thousands of one-on-one networking meetings. We have certification workshops. So on the Wednesday, November 6th, we have a one-day workshop where you can become a certified medical tourism specialist. And we have some executive summits and industry forums. So there are a lot of different things that you can participate in as a buyer of healthcare, a lot of education, a lot of networking opportunities. And, some of our other speakers, we have Zappos, the cultural evangelists from them, talking about how do you create customers, which are raving fans. Dr. Marty Makary, who's a New York Times best-selling author and famous doctor of the book Unaccountable. We have Facebook coming to present, another New York Times best-selling author, Joseph Graney, talking about Change Anything. And then we have Peter Tippett, the Chief Medical Officer and VP of Verizon. So to talk about the conference, it is integrated. So it's interesting because besides the medical tourism side, what you have is the Employer Healthcare Congress, which is made up of the Self-Funding Employer Healthcare Conference, the Corporate Wellness Conference, Voluntary Benefits Conference, National Healthcare Reform Conference, and the 4th Global Benefits Conference. So a lot of things going on, but what it's really neat is it really brings in a diverse group of buyers of healthcare from all different sectors. So people who are interested in health and wellness amongst their employee population or their insured population, people focused on healthcare reform or self-funding. And while the Employer Healthcare is a U.S. conference that's focused on the U.S. benefits in healthcare, we get a lot of international participation from international employers and insurers who are doing self-funding or corporate wellness, or who are going through their own healthcare reform. And then we have the Global Benefits Conference, which is the only global benefits conference in the world that's just there for multinational employers and insurance companies. So some of the executive summits at the conference, some are invite-only, where you have to request an invitation. So, for example, we have the Global Ministerial Summit, where we bring in ministers of health and tourism and economic development from all over the world. It's the only one that happens in the industry. This year we have the Bupa Global Provider Summit, which is an invitation-only event that's a Center of Excellence conference, where Bupa is bringing in its top hospitals from around the world as Bupa rolls out a Center of Excellence program and really directing their insured to travel to hospitals in different parts of the world that are centers of excellence. And they're one of the largest international insurers, and they cover, I think, about 14 million people globally. And we're going to see this as a big trend going forward as a lot of international insurers enter the space. The Global Medical Network Summit, which brings in medical network directors of top insurance companies and employers who are solely responsible for contracting with hospitals in different parts of the world. And we have the Medical Directors Summit, which brings in top hospitals and insurance companies or medical directors to collaborate. And so with that, I'm going to jump and turn it over to David Bryan to talk a little bit about the Global Benefit Buyers Program. And then after that, I'm going to kind of go into some of the benefits as a hosted buyer to participate in the conference. So over to you, David.
Thank you, Jonathan. I appreciate being invited to this webcast this morning. The Global Benefits Association, we collaborate with all the other associations. Glad to be able to keynote us a little bit today. For those of you who don't know us, the Global Benefits Association is 5 years young, give or take a year or two. I still try to count. I've been president of the association for 2 years, and I think I have one more year in my term. We're an association that covers a large spectrum to provide a lot of benefit to multinational employers, transnational employers, as I call them, insurance companies, brokers, consultants, as well as wellness firms and assistant companies. What is one of our key hallmarks, and is a little bit different than maybe some other groups that are out there, is we try to be collaborative. We want to work with all our members, and it's like a small-knit group of friends is the way I try to see it and make this run. And we focus in on best practices, whereas some other groups, maybe it's education, one-way communication. We definitely push for collaboration and for two-way communication. Some of the things we developed in the past year as tools and as a member of the Global Benefits Association, or GBA as we're known, are a couple of things. One, we're in the process of developing, I believe, the first online certificate education course focusing on international employee benefits. This is exciting because it will allow the new practitioner, say with 2 or 3 years in Seattle working for a multinational, to get online and get some of the basic information she or he needs to know about international employee benefits and all the aspects of global benefits. But also, say for the 20-year practitioner over in Tokyo who wants to brush up on a particular area, maybe international pensions, they can go to this course online and then go through the course that they feel they need to, supplement their knowledge and skill base. So we're really excited about that, and we're in the midst of putting it together, and we hope to have it rolling out very soon. We also have an online resource center, which is something we've been working on, and this is where that collaboration comes in again, where as a member you go on, and depending on what your needs are, you go search for what are usual and customary benefits in, say, Saudi Arabia. And within the resource center, you should be able to find that. We're happy that in talking with collaborating, one of our major member companies, Generali Insurance Company, has shared and contributed their annual country benefit manual. So there's about 70 or 80 countries that they cover year to year and provide usual and customary benefit practices, benchmarks, usual and customary social benefits. So that's a nice collaboration. The idea of the Resource Center is it's a two-way street. A little bit of a theme here on the two-way thing. So that if you go there and take something out, but we also want you to contribute. Perhaps you've got a PowerPoint or a paper that's not covering a topic that you see in the Resource Center, we'd ask you to share it with us. And then one of the other exciting things we've done is working with the MTA, we've put together a global medical network of best practices of those providers around the world. Our members, over 2,000 employers, had come to us saying, geez, I have employees around the world, and when they're on assignment, or be it long-term or short-term, if they have needs, where should they go? There's certainly other areas they can get, but since they're already a member and we work with the MTA, we're able to come up with a network of centers of excellence that we can steer and refer our member employees to, and it's worked out quite well. There we go. So who are the global benefits buyers? I want to make sure I didn't skip. I may have just jumped on. Let me go back. Yeah. Okay. Nope. Good. As I said in the previous slide, they are multinational employers, and these can be employers, be they American, Canadian, Costa Rican, French, Japanese, Chinese. It's the whole gambit. And so that's a core foundation of our membership. But an important, as well as integral part, are the multinational insurance companies, be it Cigna, Aetna, again, American companies, ING, which is Dutch-based, Daiichi, Japanese-based. These are member companies that see the benefit of being part of this Global Benefit Association to network, collaborate. And then there's international assistance companies such as International SOS, there's IMG, and MSH. There's a whole list of companies that provide this. What I don't have listed here are wellness companies. There's a whole list of wellness companies. That's kind of a buzz now, providing global wellness to the international employee, as well as brokers, consultants, third-party advisors, people like me. When I'm not working with Jonathan in the Global Benefit Association, I have my own global benefit consulting practice. So there's an integral part, too, of part of this buying group. And then kind of pulling all this together, if you will, the individuals in charge of the hospitals contracting for insurance companies. So you've got the hospital, be it U.S. or be it in Bermuda or Bahamas or Costa Rica or down in Latin America. You've got them working with insurance companies to set up a network, become part of a network, negotiate for potentially discounts, then also bringing in an assistant company, perhaps, and then targeting the multinational employer, the employees of that company that are going to be accessing, in most instances, the services of that provider, the hospital, doctor, physician, in that particular country. So we see it kind of all intermixed and interlinked, again, this big but small family of collaboration together. At the Global Benefits Conference, the GBA will be there. I'll be with Jonathan. We'll be at a very prominent booth. You will not be able to miss us. I myself will be chained to a desk, I've been told, and I look forward to being there. But most importantly is if you're a buyer, there's many ways to work with you and get to know you. Certainly introduce yourself in person. Come by. Now that you see us, let us know you by coming by the table. If you're a buyer, we can introduce you to the right healthcare providers, be they at the conference or be they part of a membership within our groups. If you're a healthcare provider, let us help you provide some insight into the industry, into some of the buyers, and how we might be able to put the two together. And there's this great, I don't know any other conference that does as well as the ones that we promote and put on, and it's the scheduling software in terms of networking. That, I think, is great. And so I would encourage you, if you haven't utilized it, please do. There'll be my email as well as through the GBA. You can contact me, and I would look forward to having an opportunity to meet with you. A couple more slides here. There's something that just came up on the news last night, which we're really excited about, and that's more U.S. employers are implementing medical tourism for a variety of reasons. I know that within the news within the United States, the networks and TV has been blanketed with our budget issues and the Congress issues and the shutting down of the government. But the Medical Tourism Association has been working with ABC News, Nightline and Diane Sawyer in particular, to help them work and cover, really kind of the first time, about a company in North Carolina called HSM, who for the past 7 years has sent employees overseas for medical procedures. I think they've sent upwards of 250 employees overseas, and they've saved over $25 million. At the end of this presentation, we're going to provide a link that will bring you to the YouTube to watch it. It's about a 10-minute segment. It is very compelling. It's something that I saw this morning for the first time, and it's a well-done piece. It shows two individuals from America going to Costa Rica for procedures, and the way it's handled and done and the savings, as well as interviewing the companies, is, I think, cutting edge and very exciting. And there's a lot of American companies that are doing this, but they really, for some reason, are very shy about it. And I give credit to HSM as well as ABC News, working with MTA, to make this out there so that everybody can see this has been ongoing and the benefits of it are phenomenal. So there was a question asked by the benefits manager in the piece, and I don't want to give the whole thing away, with the new healthcare in the U.S., will there be more or less? And he said, by far more. He thinks the U.S. healthcare system is broke, and there are a number of options that are better than the American health system. So I think it's really keen and eager for us to pursue. I would encourage you to watch it. Finally, I think I'll finish up the GBA buyer meetings. I've mentioned this before. There'll be opportunities to work with the GBA and access the U.S. and international marketplace. I said we've got a large contingent of buyers, employers. There's a lot of ways we can do that through private workshops around the country. We can bring in insurers and employers and we can promote your aspects of what you have, as well as webinars and webcasts such as what we have here. And we're certainly on, I've done many of these already, private one-on-one meetings with a number of organizations to try to bring the two together and enhance what they're trying to market in terms of increasing the results. There's the link that when we send this out afterwards, you'll be able to access. And I think with that, I thank you and turn it over to you, Jonathan.
Thanks, Dave. Great coverage of the GBA and kind of explaining the association and what you guys are doing. And I definitely appreciate your support of the Medical Tourism Association over these last couple of years. So I'll talk a little bit about the Hosted Buyers of Healthcare program and who qualifies for it: insurance companies, governments, employers, insurance agents, facilitators. And what do you get? It could be, depending on who you are and how you qualify, free registration pass for the conference, discounted registration, hotel room nights and flights. So you can apply now on the Medical Tourism Congress website. And this is a profile from our pre-approved international buyers. You can see there's representation from all over the world, from all 5 regions: Africa, Asia, Canada, Caribbean, Europe, Middle East, and the Americas. So what are the benefits of participating? You can be the VIP. Definitely one of the biggest advantages is becoming more of an expert, sitting down in sessions. And there's no other place in the world that you can get the education that we provide at our conference and bringing together all the experts. I'm a huge believer knowledge is power. The more that you know, the more expertise you have, you're going to be able to make strategic moves in ways that your competitors won't be able to. You'll have information in how to access the patient, how to get them to travel more, what markets to go after. An important part of that is uncovering new opportunities for growth. We've seen people come to our event and find out about a procedure they didn't even know existed. And then they turn around and send 500 patients that coming year for that specific procedure. So unless you're really connecting and touching everybody in the industry who's doing everything, you're going to miss opportunities, whether it's new hospitals, whether it's new procedures, new initiatives in the industry. You really have to stay educated and on top of this. Obviously, as a hosted buyer, you can create new client relationships. So you can identify new hospitals and partners you might want to work with, whether it's a hospital that is doing a cutting-edge procedure that you would like to start sending patients over for. Maybe they have lower complication rates, better outcomes. Maybe the pricing is better in some areas, better quality. Maybe you are working with a hospital and they're having service issues. It could be you're a facilitator or a buyer and you're working with a hospital and you're dealing with commission issues, or that hospital backdooring you. And what I mean by backdooring is the hospital starting to go to your patients directly and cut you out of the equation. So maybe you're looking for new hospital partners. Maybe you want to expand to a new region. Maybe you want to expand to sending patients to Europe or to Africa or to Asia, and so you want to meet hospitals. Because we all know as a buyer, it's very difficult, the constant feedback I get from buyers of healthcare, very difficult to identify what hospitals to send patients to, because there's so many hospitals out there in the world promoting themselves. And then the second hardest part is building a relationship and being able to get a contract with that hospital. Because one, it's difficult to build a relationship, and two, it can take forever, 6 months to a year or even longer to get a contract signed. And I know that you can't wait that long. So, a lot of it's also collaborating and working with your peers, working with other buyers of healthcare to expand your network and see how you can collaborate and strategically do things in a greater way than you can do by yourself. I'm really excited that we have our buyers forum today and facilitators forum that's going to happen at the conference. So you'll be able to sit around other buyers of healthcare and discuss best practices, case studies, legal and liability issues, contracting issues, how you can participate in the global medical network, what are ethical ways to increase your revenue from healthcare consumers, creating these new partnerships so you can grow faster, increasing conversion from inquiries with healthcare consumers, working with global buyers of healthcare, and kind of consolidating your resource to work with other buyers so you can lower your expenses and increase efficiency, which will help you get out to the consumer and the buyer markets faster. So that forum is Sunday, November 3rd from 9 to 12. It's invitation only, so if you'd like to attend and you're a buyer of healthcare, just send us an email, and we'll invite you to it. We have a medical directors summit, also November 3rd, for medical directors from both hospitals and insurance companies to connect together. And then the first Global Medical Network Director Summit. So some people might not understand the importance of this, but this is the first event in the world that's bringing together the medical network directors who are responsible for contracting with hospitals all over the world. So they're the ones that determine what hospitals patients go to, whether they're with an international insurance company, a medical assistance company, whether they're covered by travel insurance and there's an emergency. And what we've seen is there's a big disconnect where the hospitals and healthcare providers don't realize the huge opportunity they're missing with the Global Medical Network directors. So it was about 2-3 years ago at our conference, I helped connect a medical network director for one of the biggest insurance companies in the United States with a hospital in the Caribbean. And this huge insurance company had a lot of their insured who were on cruise ships. And the cruise ship was stopping at this island, and they were having heart events. Basically, people were having heart attacks while they were on the island or on the cruise ship docked at the island. And what the insurance company had been doing was putting them on a plane and emergency evacuating them back out to the United States, to Miami. And the reason why is they didn't even know there was a heart hospital on the island with an expert surgeon with amazing success and outcomes. So we helped facilitate that connection, and then they signed up with that heart clinic, and now instead of evacuating the patients, they send the patients to that hospital. And so that's a major game changer for that local hospital, is being able to make that connection. So that's important for the Global Medical Network Director Summit. So we already talked about the PUPA Global Providers Summit. We're going to have a buyer's pavilion in the exhibit hall, which is connected to the Medical Tourism Association booth. So it's going to be a lounge area with couches and everything where we're going to have VIP hosted buyers at specific hours and where they can hang out during the exhibit hall. So what we're going to do is then bring in healthcare and hospital providers in countries that would be good fit for those specific buyers for you to really connect and have one-on-one meetings with. So it allows buyers to really expand their network without having to try to figure out who they need to meet with or who's coming to the conference. And so we bring in buyers from all over the world. So just as one example, we're bringing in 15 buyers just from the Russia and CIS countries. So you can, meet them at designated hours in the hall. And then we bring in the buyers from all over the world. I think one of the best benefits of our conference is the networking software, face-to-face meetings. So you can have as many as you want. You schedule them through the online platform, look who's coming. So if you're a buyer, you can look at hospitals, insurance companies, employers, other buyers and facilitators you want to meet with, and schedule meetings and meet them either in the buyer's lounge or meet with them in the networking area inside the exhibit hall. So obviously with our networking platform, you can add your profile. So as a buyer of healthcare, I definitely provide an in-depth profile, add your interests, create your own personalized agenda, and you can segment your target audience. So if you're only interested in hospitals in Latin America or in the Middle East, then you can segment that and invite people based upon that. Obviously, from the healthcare provider side, it's important to have a presence because if you want to attract healthcare consumers and build a brand, you need to be seen. If you want to meet with the buyers, the insurance companies, the employers, and the government, I know they have a very limited resources to travel, so they're not going to be able to travel to different countries. So we're seeing the healthcare providers that are aggressive and learning that they're going to come and actually meet the buyers, those are the ones that are going to get the business, not the ones that sit back and wait at their hospital, email people, tell them they have a beautiful brochure, and please send me patients, because there's probably 500 to 1,000 hospitals and facilitators that are doing that on a constant basis. So it's very important to have that face time with buyers, and buyers want to send patients to a hospital or a doctor where they have healthcare trust and they've built a relationship. So you can also learn strategies on how to attract international and domestic patients and learn from case studies from other hospitals that are really successful. This year, if you're a doctor who's actually a buyer of healthcare sending patients overseas, or you're just a healthcare provider, we have CME Credits, Continuing Medical Education Credits, in partnership with the University of Miami Health System and the University of Miami Miller School of Medicine. So we launched the first CMEs in the country last year, and we've really expanded on those so your doctors can come, get their CMEs, and you can learn about dissecting the medical travel process, quality issue and liability, planning a site visit, contracting with providers, and risk assessment and management. So one of the advantages also for buyers is you can streamline your whole international healthcare experience. You can connect with employers and insurers who have implemented medical tourism and global benefits and learn from their experience. The collaboration and sharing of challenges, I think, is really important, not just best practices, but what challenges have you experienced, and how, as an industry, as a buyer of healthcare, can you guys work on those challenges together? And obviously, I think the best advantage is meet some of the top healthcare providers from around the world. I was talking to a buyer about a month ago who's coming from Europe, and they send, I think, it was 150 patients overseas per year, a lot of them for major procedures, hearts and transplants. And, the biggest challenge that they said they faced was healthcare providers. They're having a real challenge finding healthcare providers, and they have to travel to events to do it because the healthcare providers don't travel to them, but they're having a hard time finding quality providers that they can trust and feel they can really work with over the long term. So this is just an example of our exhibit hall. This is buyers, so you can just understand off to the right is the entrance where you come in, and there's the MTA lounge and the buyer pavilion. So we're going to have a sold-out hall again on both sides of the MTA and the EHBC. So you've got the MTA lounge and then the buyer pavilion right next to it where the buyers will be located, and then the employer healthcare and benefits lounge next to it. If you scroll to the back, you'll actually see the stage. So that's the stage where we're going to have entertainment and other things. In the very back of the hall is the networking tables, and then one thing that you really can't see is in the back of the EHBC side is just a wellness market, which is going to be a really neat experience if you're a buyer just to check out. We have some really neat things in there this year. An organization that it's all about staying healthy, so they're going to have bicycles that you actually bicycle on, and there's a milkshake attached to it, a blender, and you actually power the blender through biking, and you can make your own milkshakes. And then we have a beauty bar where women, if you're a woman buyer, you'll be able to get makeovers and other facials. And then we actually have sleeping pods that, Google is famous for, these really high-tech, cutting-edge pods that people take naps in to regenerate. And what's interesting is they're really becoming big in the healthcare sector, and hospitals are putting them in place for doctors to take naps. So they're kind of like little space-age pods. So how do you apply as a hosted buyer? It's simple. There's the link to apply for it. And then if you also are a buyer or you know buyers, please encourage them to click the link and go to it. And then if you're a buyer and you're interested to know what other hosted buyers are coming, there's a list of the pre-approved buyers, and then below that is an updated participant list. Although for some reason it says 2012. So there's a chance either if the link is just typed wrong, or potentially the wrong link was put in there. But if you go to the website, right at the top, they'll say participant list, and then you can click on the participant list for 2013. So hope to see all of you. The conference is November 3rd through the 6th in Las Vegas. It's going to be our biggest year yet. I know usually 2 to 3 weeks before the conference we sell out our room block, but this year it happened about 5 to 6 weeks ahead of time because of participation is much greater than before. So with that, we're going to turn it over to questions. For any of you that might have questions, if you're a buyer, regarding the Buyer of Healthcare program. So there's a question box, and feel free to type in any questions in the box if you have any. And let's see, let me pull up the questions here. Dave, we have a question from Jamal in Saudi Arabia, and he is asking, you know, how do you go about if you're a hospital or healthcare provider interested in working with a buyer of healthcare? You know, what are some of the best ways to connect with international insurers or employers? Where do you start?
There's a variety of ways, and really the best place to start, obviously, is through the Global Benefits Association. But what we do and what we've done with other like situations, we want to promote and raise awareness of that particular hospital's or number of hospitals' presence, where they are, and what do they have, and what value added can they bring to the table. And we take that message, we package it, and then through a number of, if you will, distribution channels, be it a webinar specifically covering, it could be intermingled with covering employee benefits in the Middle East, and then we highlight providers and this particular provider, or a specific webinar for this particular provider. In addition to get very specific and segment our members of the GBA, who are the actual buyers, would be some of the buyers, and try to match them up with the facilities and try to bring the two together. The buyer, the company, may not be aware of or has limited exposure to the particular provider, and through the networking of the GBA, we kind of bring the two together, and we kind of act as a connector, networking link. That's one way, another way to do it. And then another way to raise awareness, which works really well, which I kind of referred to on our resource center. Generali wanted to raise their awareness within the whole network of the GBA, so they sponsored or they became a sponsor of our resource center, and we can have providers or other interested parties become potentially a sponsor of, be it a webinar or even a one-on-one, one-day or half-day session covering a particular topic, and that will raise the awareness. So it's kind of raising the flag, a little bit of marketing, but because of the GBA and our membership, we've already got a captured and captive audience that we'd like to bring to help, provide and direct the members or buyers to the facility.
Thank you, Dave. Another question that came in from Jenny, and she's in the United States, is she asked, typically, hospitals are handing out a brochure, and sending them a link to their website, and is this sufficient in getting an international insurer or an employer to want to work with a hospital? Can you just give a brochure and a website? What or is there more that you have to do? We were working with a hospital up in Seattle, and they were trying to draw some of our friends from Canada down. And they took that approach, and they realized they weren't getting as much traction and traffic, if you will, as they wanted to. And so they engaged with us to come up with a number of ways to promote themselves, some of the things I touched on in the previous question. But the answer to your question, a brochure and website is analogous to a billboard. It will have some effect, and people and buyers will take notice of it, to be sure, but it's a very passive way of marketing. With a little bit of effort and investment of time, and again, working through the MTA and the GBA, we can collaborate and interconnect with some more buyers, as well as come up with a marketing program on a consultative basis to help promote further that hospital to get further medical tourism and tourist patients in their facility. It doesn't take a lot in terms of effort or investment to do, but it's certainly better than, and again, don't get me wrong, the website and the brochure is fine, but with just a little bit of effort, the traffic can be increased significantly. Thank you, Dave. And it looks like we're kind of running out of time for questions. We ran a little over. We're trying to keep this webcast to about 30 minutes, and I know Dave's got some international calls. So we're going to make this webcast, the PowerPoint and the video, available afterwards to everyone who was on the call. So that should take about 48 hours, and we're going to sync them together so you can watch the video and the PowerPoint together. And then if you have any questions, you can email David directly. David, what's your email address for them to email you?
It's david.bryan, B-R-Y-A-N, and my company's name is Xensell, Xensell.com. Again, Xensell.com.
Okay, thank you. And then Dave will be at the conference and in the exhibit hall. So anyone who has questions about, working with buyers of healthcare, they can connect with him. And if you're a buyer of healthcare, I also encourage you to connect with Dave and see how you can collaborate. Dave, thank you so much for taking your time and coming live to us from Chicago. And I'll be seeing you in a couple weeks.
Great. Thank you for having me, Jonathan. It was a pleasure.
Take care. Everyone have a great week.